Namaskar. I bring you this week more news and developments in the field of health, especially to do with the new coronavirus. The first is a major study that comes from Israel, which compares directly the effect of the Delta variant of the virus to those who are vaccinated and also to those who are previously infected, that is, who have natural immunity. And there is good news for both. The second is with this study and with various other studies and reports coming in, what are the various governments of the world doing in our respective countries? They are, of course, talking about booster vaccines. That is something to look at. The third is a new phrase which may be of extreme relevance, actually, which they are calling hybrid immunity. We can have a brief look at that. And lastly, with all of us, trying to get back into a kind of normal mode and getting back to our work and other activities, this issue of vaccine mandates and vaccine passports is now further getting aggravated with even court cases and rulings. So let us have a look at these 4 news items of the week over the next 10 to 12 minutes. The Israel study is a massive study where they had the records of nearly 700,000 people. They were concerned, the research scientists were concerned that vaccinated people were also catching the infection, especially after the Delta variant. So they did this study where they took a group of 32,000 patients, half of whom had prior infection and therefore had natural immunity and were unvaccinated. And they had the other half of 16,000 more who were fully vaccinated but who had not had any prior infection. And then they studied the records of these people over a long period of time, between June 1 and 14th August to be precise, especially when the Delta variant was at its peak. Now what they found is very, very interesting. They found that the Delta variant of the virus was able to break through the immunity barrier created by vaccines far more easily than it could break through the immunity barrier in those who had prior infection, which means who had a natural immune barrier. Now this is not so surprising if you consider in one earlier video we discussed exactly why natural immunity is so powerful, because it creates a whole suite of antibodies, whereas the vaccines with all good intentions can only create one particular antibody. And the Delta variant is a mutant. It is a different strain, and therefore it is able to overpower the vaccinated person. But let me share the good news for all. Even though the study involved 32,000 people, 16,000 from each group, the total cases were very few, about 258, I think. But out of which the cases among those vaccinated were 13 times more than the cases in those with natural immunity. This is by far the largest real-world observational study done after the advent of COVID-19, and in a country which is the largest vaccinated. So it's a very significant study which does a direct and scientific comparison between those with vaccine-induced immunity and those with natural immunity, and how they stand up against the COVID-19 virus and its variants. Now this large study is only one of a series of other studies which have been coming repeatedly, many of which we have shared in earlier videos in this channel. So what are the various governments of the world thinking now? Are they saying, after having a look at this Israel study, oh, this is fantastic. This means that those with prior infection, whose antibody levels can be tested properly through a serology test, now can they be exempt from various other demands that we are putting in society now? Can we confidently announce to the world that vaccinations can actually be diverted to those who really need it, and they need not be wasted on people who already have been infected and have strong antibody levels? Unfortunately, no. The governments of the world, to begin with Israel and then the US and Chile in South America, a few countries in Europe, probably UK also, have all announced that they are in favor of, and some have even started giving what is called booster doses. They said 1 dose initially and then 2, and now they're saying a third. And many physicians are warning that there is no end to this, and this may become an annual phenomenon. Guess who's happy with all this? Of course, the pharma companies. Moderna and Pfizer both have a control of about $60 billion of sales only through COVID-19 vaccines. This is estimate for last year given and this year given by industry experts, and they themselves are revising their sales and profit figures in their communication to shareholders. This is the ugly side of the COVID-19 story. This is not science, because the scientific evidence that the Israel study showed goes completely contrary to this. This side of the story is where science has been hijacked by commerce. Interestingly, the World Health Organization has said just 4 days ago that that current scientific data does not indicate the necessity of booster shots. And they have also pointed out to the inequity part of vaccine distribution in the world by saying that wealthy nations should withdraw, this obsession towards booster shots and let the available vaccines first go to poorer countries who need it most. Like we have shared previously, in case you haven't seen that video, there are many hundreds of countries in the world who have not even vaccinated 5 or 10% of their populations, while 80% of the vaccine availability is going to just the top 10 or 15 wealthy nations. So this is a story about health. It is also a story about science. It is also a story about misinformation about science by the medical administrators and governments. It is a story about commerce, about profiteering, and also about injustice. Let us move to the last part of the news developments this week, and that is about the vaccine mandates. How much right does a corporation, does an institution, does your school, does your college, does your university, does your transport company have in forcing you to take a vaccination? I mean, this goes contrary to all the evidence being presented that what society should be concerned with, what all of us are really concerned with, is immunity. If a person has immunity and can prove it, that should be enough. But they're still hesitating to accept natural immunity, and so there are court cases coming up in various parts of the world challenging these vaccine mandates, and the European Union has reluctantly added the previously infected as those who can be issued the vaccine passport, but not through an ordinary, serum antibody test, which is the most obvious thing to do. They are saying, no, you should have gone to a hospital, been declared as COVID positive, and been a patient at that time, and that certification would apply, but again only for 6 months. Somehow, even though all evidence shows that it is the vaccinated whose immunity is waning and they are repeatedly getting the infection, and it is the naturally immune whose immunity is lasting so far, it has not, it has reinfected a minute percentage of people, yet they are doing the reverse. They are spreading this canard, the official agencies, that natural immunity may not last long, it may wane, when study after study is showing the opposite. This is a sad part of what's going on, but we should end on a good, healthy, positive note. The fact here is that the immunity story is not known by many people. We must also do our best to share it in a friendly spirit. People who have vaccinations, it's good that they have it, and it does work to the extent that even if they have the infection, it will be mild. And those with natural immunity are far more protected. But it's not vaccine versus natural immunity. Both are immunities. Both are working for and in favor of us our bodies and in favor of a healthy society. It is the powers that be that are making this wedge between what is a single story of immunity and making it just vaccine based immunity and pushing at it with some very extremist aggression. As far as those of us who believe, who have the self-confidence of natural immunity, we do not want to defeat the other. We want to win them over. So show them facts. As usual, I'll put more links in the text description below. Read them yourself, share it with your friends, family, neighbors at your workplace, and maybe even to your political representatives. They all have to know, because somewhere the mainstream media is not telling everyone what's going on. We'll meet next week again with the developments of the next week. And meanwhile, I probably have left out one bit, but the time is running short. It is on what is called hybrid immunity. I'll do a separate video on that and post it. Till then, take care all of you. Be healthy, be happy. Namaskar.